exploring the impact of a trauma-informed yoga and mindfulness curriculum for multiple populations, a pilot study. This is printed in ScienceDirect.com, January, February 2024. Highlights. After yoga, stress was reduced and mood improved for 4 populations, including people who are incarcerated, people in treatment for substance use, veterans, and youth. Across multiple sessions, both the largest decreases in stress and greatest increase in mood occurred after participant in the first session. A specific exploration of curriculum class impact by theme for participants who were incarcerated indicated no difference in impact by theme. For individuals in treatment for substance use, reductions in systolic blood pressure occurred immediately after the first curriculum session, and diastolic blood pressure reduced over 3 consecutive sessions. Abstract. Individuals with trauma experience negative mental health impacts and are at risk for poor cardiovascular outcomes. Unmanaged, these conditions may worsen, compromising healing and well-being. Yoga, particularly trauma-informed, may improve outcomes. The current pilot study explores the impact of a novel trauma-informed yoga and mindfulness curriculum on well-being in 2 parts. The first examined mental health, stress, mood outcomes in 4 trauma-impacted populations: adults who were incarcerated, individuals in recovery from substance use disorders, veterans, and vulnerable youth, assessing both the impact of individual class participation and impact of attending at least 4 curriculum sessions. For the subgroup of incarcerated individuals, impact by theme was examined. After curriculum sessions, stress was reduced and mood improved. Across multiple sessions, both the largest decreases in stress and greatest increase in mood occurred after participant in the first session. Further, a specific exploration of curriculum class impact by theme for participants who were incarcerated indicated no difference in impact by theme. The second part of this study explored cardiovascular outcomes for populations for those in recovery from substance use. Reductions in systolic blood pressure occurred immediately after the first curriculum session, and diastolic blood pressure reduced over 3 consecutive sessions. Introduction. There's a growing awareness of the benefits of stress-based approaches addressing the many impacts of trauma, and a growing number of nonprofits are providing services rooted in mindfulness and embodied movement practices. Programming seeks to share access to holistic and often cost-effective approaches to resilience building, physical health, and mental well-being. To sustain impact and grow programming, it becomes important to demonstrate the effectiveness of programming, including impact for specific populations. The current study represents a pilot exploration of a trauma-informed yoga and mindfulness curriculum as implemented with 4 priority populations: people who are incarcerated, those in treatment for substance use disorders, veterans, and youth. Yoga is associated with physical well-being, including components in cardiovascular health and reduction of cardiovascular risk, specifically hypertension. According to a systemic review of 37 randomized controlled trials of 2,768 individuals, Adults who practiced yoga had a systolic and diastolic blood pressure reduction. Another systemic randomized controlled trial review by Barrows and Fleury summarized 9 peer-reviewed studies investigating various cardiovascular outcomes associated with yoga. Of the reviewed studies, 5 specifically evaluated blood pressure, and 2 found statistically significant improvements in systolic blood pressure compared with controls and or usual care. The impact yoga has on well-being has been well documented in studies across a variety of populations, and yoga is associated with improvements in psychiatric and mental health conditions, including stress, mood disorders, attention deficit and hyperactivity disorder, anxiety, dementia, post-traumatic stress disorder, insomnia, as well as the effects of chronic pain. The reduction of stress, both acute and chronic, through yoga has been shown to reduce other comorbidities of disease and improve stresses associated with increased quality of life. Because of these widespread benefits, clinicians increasingly are recommending yoga as a complement to psychotherapy and medical management. Yoga benefits have been demonstrated across every age group as well as specialized populations, including people who are incarcerated, people suffering from substance use disorder, military personnel, youth, and survivors of trauma more generally. The use of yoga specifically developed for populations with emotional, physical, or social needs related to trauma sequelae is increasing. Given that population with trauma may already be compromised, these studies suggest that our communities are incurring even greater costs associated with the individual's deteriorating or reduced mental and physical health status. To address this need for improving health and well-being outcomes among people underserved by healthcare, mental health, behavioral health, or other social services, Yoga for Change, Inc. is a nonprofit organization developed a novel, low-cost yoga and mindfulness curriculum to address trauma and improve mental and physical health by integrating physical movement, example, body shapes and forms, with trauma-based thematic teachings, example, forgiveness, self-acceptance, vulnerability, etc. These teachings are specifically developed for 4 populations, including incarcerated individuals, those dealing with substance use, and behavioral health diagnosis veterans and youth. The current program is unique in that it moves beyond yoga-only physical offerings to incorporate programming that is strength-based, trauma-informed, and contains multiple components to support of holistic well-being. The current study represents a pilot exploration of a trauma-informed yoga and mindfulness-based curriculum implemented with multiple populations. The study examined the impact of Yoga for Change manualized curriculum with the goal of demonstrated viability generally and within 4 specific priority populations. To that end, we implemented 2 specific explorations examining the impact of trauma-informed mindfulness-based curriculum. The first examined the impact of programming on self-reported ratings of mood and stress across 4 populations: people in treatment for substance use, people who are incarcerated, veterans, and youth. The intent was to provide insight into the outcomes associated with a specific curriculum, but also to explore comparative data on potential differences in impact across the 4 populations and after multiple sessions. The second part of this pilot study examined the impact of the curriculum on cardiovascular outcomes, blood pressure and heart rate for individuals in treatment for substance use disorders. The purpose of this pilot exploration is to demonstrate viability of programming in support of curriculum development, implementation, and further controlled study. Discussion. With the pilot multi-site study of 4 different populations, including 925 adults and youth, there were statistically significant and clinically meaningful improvements in psychological well-being, stress, mood, self-reported outcomes after exposure to one yoga class using a trauma-informed curriculum. The study demonstrates that incorporation of a trauma-informed yoga and mindfulness curriculum decreased stress and improved mood for participants, and that participants experienced benefits. Conclusion. Despite limitations, our study provides evidence of the benefit of a multifaceted, trauma-informed yoga and mindfulness curriculum in support of physical and psychological well-being. For those in treatment for substance use, we noted preliminary impacts on cardiovascular health, systolic blood pressure, diastolic blood pressure, heart rate, and further we noted evidence of the positive impact on participant-reported mood and stress for people who are incarcerated, veterans, and those facing substance use disorder.